The most incomprehensible thing about the universe is that it is comprehensible. This study addresses an essential gap in the sequential use of maternal RSV perfusion F vaccination, RSV pre-F, and infant Nirsevimab for preventing RSV lower respiratory tract infections. Conducted as a prospective, randomized, open-label Phase 4 trial, it involved mother-infant pairs randomized to receive either the maternal RSV pre-F vaccine alone, both maternal RSV pre-F vaccine and infant Nirsevimab at birth or at 3 months, or solitary infant Nirsevimab at birth. A total of 181 mothers enrolled, with follow-up focused on safety, tolerability, and the magnitude and durability of RSV-A and RSV-B neutralizing antibodies, NAbs, over 12 months. The primary endpoint assessed was the safety and immunogenicity of the regimens, with interim data reported up to the 4-month infant follow-up.
Quick take. This trial explored how mothers' vaccination affects infants' RSV immunity alongside or separate from the Nirsevimab shot.
The trial observed robust maternal RSV-A NAb increases, a 17.35-fold boost, maintained up to 3 months postpartum. Nirsevimab was found to be well tolerated, with no serious adverse events in either mothers or infants, and all reactogenicity was mild to moderate. As infants reached 6 weeks and 3 months, they displayed highly elevated RSV NAbs with minor waning differences between groups. The authors conclude that maternal RSV pre-vaccination and infant Nirsevimab, alone or combined, maintain high RSV NAbs in infants up to interim follow-up and demonstrate a good safety profile.
Quick take. Results showed infants sustained high levels of RSV immunity, providing reassurance that both interventions are effective and safe.
Short quiz, clinical vignette. Question: a 29-year-old pregnant woman receives the RSV pre-F vaccine. Post-delivery, her infant is administered Nirsevimab at birth. By 3 months of age, how would this infant's RSV neutralizing antibody levels most likely compare based on the trial's findings? Option 1. Substantially lower than infants who did not receive Nirsevimab. Option 2. Equivalent to infants who received Nirsevimab only at 3 months. Option 3. Slightly elevated with minimal differences in waning. Option 4. Low and indicative of reduced transfer of maternal antibodies.
The answer is option 3. The study indicated that at 6 weeks and 3 months, RSV neutralizing antibodies were highly elevated in infants irrespective of group, with modest differences in waning. Thus, the combination of maternal vaccination and Nirsevimab at birth leads to sustained high antibody levels in the infant.